Welcome to ZenZone Health. Today we delve into a crucial topic, the 7 deadliest types of cancer. Understanding these cancers can empower us to recognize symptoms early and seek timely treatment. We'll explore their risk factors, symptoms, and the importance of early detection. This information could be life-saving for you and your loved ones. Let's dive in and arm ourselves with the knowledge to fight back against these formidable foes. Stay tuned, because this is information you won't want to miss.
Lung cancer, also known as lung and bronchial cancer, is one of the most common and deadliest cancers, especially in individuals aged 65 years or older. Smoking remains the leading cause, but secondhand smoke exposure also significantly increases the risk. It's a silent killer that often goes undetected until it's advanced. Symptoms include a chronic cough, coughing up blood, shortness of breath, and chest pain. If you or someone you know experiences these symptoms, seek medical advice promptly. Early detection can make a significant difference in treatment outcomes. Regular screenings, especially for smokers and those exposed to secondhand smoke, can help catch the disease early. Quitting smoking is the most effective way to reduce your risk. By staying informed and vigilant, we can catch this silent killer before it takes a deadly toll. Always consult with your healthcare provider if you have any concerns about your lung health.
Colorectal cancer is a significant health concern, affecting 1 in 20 people in the U.S. It primarily impacts the colon and rectum, and age is a considerable risk factor. Individuals over 50 are more susceptible, but younger adults aren't immune. Family history, heavy alcohol consumption, and obesity also elevate the risk. Symptoms include changes in bowel movements, blood in the stool, and persistent abdominal pain. Screening for colorectal cancer is essential, particularly for those over 50 or with a family history of the disease. Colonoscopies can detect precancerous polyps, allowing for early intervention and prevention. Lifestyle changes, such as a healthy diet and regular exercise, can also reduce your risk. Don't ignore persistent digestive issues, and always consult your healthcare provider if you notice any concerning changes. Early detection significantly improves treatment outcomes.
Breast cancer is a prevalent disease, with 1 in 8 women in the US diagnosed in their lifetime. While it primarily affects women, men can also develop breast cancer, although it's less common. Factors such as gender, age, family history, and obesity increase the risk. Recognizing the symptoms of breast cancer is crucial. They include lumps in the breast, changes in breast shape or size, and unusual discharge from the nipples. Regular self-exams and mammograms can help detect abnormalities early, leading to prompt treatment and better outcomes. Women over 40 are encouraged to have regular mammograms, and those with a family history of the disease should consult their healthcare provider about starting screenings earlier. Lifestyle changes, such as maintaining a healthy weight and limiting alcohol, can also reduce risk. Encourage the women in your life to stay informed and proactive about their breast health. Early detection and treatment can save lives.
Pancreatic cancer is one of the most aggressive and deadly forms of cancer, affecting 1 in 67 people in the United States. It's notoriously difficult to detect early, which makes it particularly dangerous. Risk factors include family history, smoking, obesity, and chronic inflammation of the pancreas. Symptoms often don't appear until the disease is advanced, including jaundice, abdominal pain, bloating, and nausea. Because these symptoms can be vague and attributed to other conditions, pancreatic cancer is often diagnosed at a late stage. Individuals with a family history of pancreatic cancer should be particularly vigilant and discuss screening options with their healthcare provider. Quitting smoking and maintaining a healthy weight can also reduce risk. If you experience persistent abdominal pain or jaundice, seek medical attention immediately. The sooner pancreatic cancer is diagnosed, the better the chances of successful treatment. Let's spread awareness about pancreatic cancer and encourage those at risk to take preventive measures.
Prostate cancer is a common health issue for men, particularly those over the age of 50. It's one of the most diagnosed cancers in men, with risk factors including family history and diets high in red meat. Symptoms can include frequent urination, weak urine flow, and blood in the urine. These symptoms can be mistaken for less severe conditions, making it important to seek medical advice if they persist. Regular screenings, such as PSA tests, can help detect prostate cancer early. Men over 50 should discuss screening options with their healthcare provider, especially if they have a family history of the disease. Lifestyle changes, such as a healthy diet and regular exercise, can also reduce risk. Don't ignore persistent urinary issues and always consult your healthcare provider if you have any concerns. Regular screenings and a healthy lifestyle are your best defenses against this common but deadly cancer. Encourage the men in your life to stay informed and proactive about their prostate health.
Leukemia is a type of cancer that affects the blood and bone marrow, leading to an overproduction of white blood cells. This can interfere with the body's ability to fight infections and produce healthy blood cells. Risk factors include family history, smoking, and certain blood disorders. Symptoms can vary, but often include night sweats, fatigue, bone pain, and frequent infections. Because these symptoms can be attributed to other conditions, it's important to seek medical advice if they persist. Early detection can make a significant difference in treatment outcomes. If you experience persistent fatigue, night sweats, or frequent infections, consult your healthcare provider. Regular blood tests can help detect abnormalities early. Encourage those at risk to stay informed and proactive about their health. Let's spread awareness about leukemia and support research efforts to find better treatments and ultimately a cure. Non-Hodgkin lymphoma is a type of cancer that occurs when lymphocytes, a type of white blood cell, become cancerous. It primarily affects people over 60 and those with weakened immune systems. Symptoms can include abdominal pain, chronic cough, difficulty breathing, and swollen lymph nodes. These symptoms can be mistaken for less severe conditions, making it important to seek medical advice if they persist. Regular screenings and monitoring can help detect the disease early. If you experience persistent abdominal pain, chronic cough, or swollen lymph nodes, consult your healthcare provider. Early detection can make a significant difference in treatment outcomes. Encourage those at risk to stay informed and proactive about their health. Let's spread awareness about non-Hodgkin lymphoma and support research efforts to find better treatments and ultimately a cure. Early detection and treatment can save lives. Thanks for watching ZenZone Health. We hope this video has provided you with valuable information about the 7 deadliest types of cancer. Remember, early detection is key to fighting cancer. By understanding the symptoms and risk factors, you can take proactive steps to protect your health and the health of your loved ones. Stay informed, stay healthy, and don't forget to subscribe to ZenZone Health for more health tips and information. Your health is your most valuable asset, so take charge and stay proactive. See you in the next video.
Welcome back to ZenZone Health, your go-to for reliable and easy-to-understand health information. Today, we're diving into a topic that's incredibly important for women of all ages: ovarian cancer. Now, you might have heard ovarian cancer being called the silent killer, and there's a reason for that. Unlike some other cancers, the early symptoms of ovarian cancer can be pretty subtle and easily mistaken for other, less serious conditions. That's why we're here today, to break down those symptoms so you can be informed and proactive about your health. Trust me, recognizing the signs early can make a world of difference when it comes to timely diagnosis and treatment.
Let's talk about bloating for a second. It's something we've all experienced at one point or another. We've all been there, that uncomfortable, sometimes painful feeling of fullness in your abdomen. It can be really frustrating and even a bit worrying. Maybe you had a big meal, or maybe it's just that time of the month. These are common reasons for bloating, and usually it goes away on its own. But here's the thing, when it comes to ovarian cancer, bloating isn't your typical occasional discomfort. It's a different kind of bloating that you shouldn't ignore. We're talking about persistent bloating, the kind that just doesn't seem to go away, no matter what you do. It lingers and becomes a part of your daily life. Imagine feeling constantly full, like you've just finished a Thanksgiving feast. Even if you've barely eaten anything, it's not just uncomfortable, it's concerning. Your clothes might feel tighter than usual, and you might even notice some visible swelling in your abdominal area. This isn't just a minor inconvenience. Now, I know what you're thinking. Bloating is a common issue, right? And you're absolutely right. But there's a difference between occasional bloating and something more serious. But persistent, unexplained bloating, the kind that hangs around for weeks and doesn't seem to have a clear cause, that's when you need to pay attention. It's your body's way of telling you something might be wrong. It could be a sign that something else is going on, and it's always better to err on the side of caution. If you notice this kind of bloating, don't hesitate to talk to your doctor. Early detection can make all the difference.
Now, let's talk about another symptom that shouldn't be ignored: pelvic or abdominal pain. Again, we all experience aches and pains from time to time, but persistent or recurring pain in these areas, especially if it's unexplained, warrants a conversation with your doctor. Imagine this: a dull, aching pain in your lower abdomen, almost like menstrual cramps, but it's not your period. Or maybe it's a sharper, more localized pain in your pelvic region. For some women, this pain might even radiate to their lower back. The key here is to pay attention to the frequency and severity of the pain. Is it a constant ache, or does it come and go? Is it mild and manageable, or is it so intense that it disrupts your daily life? If you're experiencing persistent or worsening pain in your pelvic or abdominal area, don't brush it off. It's always best to get it checked out by a healthcare professional just to be safe.
Chapter 3. Difficulty eating or feeling full quickly. A subtle but significant sign. This next symptom might seem a little surprising, but it's one that many women with ovarian cancer report experiencing. Difficulty eating or feeling full quickly. It's not just about feeling a bit off. It's a persistent and troubling sensation that can disrupt daily life. You might be thinking, really? How can that be related to ovarian cancer? It seems like such a minor issue, but it can be a significant indicator. Well, when a tumor grows in the ovary, it can actually press on the stomach and intestines, making it difficult to eat a full meal or even keep food down. This pressure can cause a range of digestive issues that are often overlooked. Imagine this: you sit down for dinner, but after just a few bites you feel incredibly full and uncomfortable. It's not just a one-time thing, it happens consistently, making meals a challenge. You might even experience some nausea or indigestion. These symptoms can be persistent and can significantly affect your quality of life. This feeling of fullness can be so intense that it makes you lose your appetite altogether. It's not just about not wanting to eat, it's about feeling like you physically can't. You might find yourself eating less and less, even if you're not trying to lose weight. This can lead to unintended weight loss and nutritional deficiencies. If you notice a significant and unexplained change in your appetite, or if you're constantly feeling full after eating only a small amount, it's essential to bring it up with your doctor. Early detection can make a big difference, so don't ignore these subtle but significant signs.
Chapter 4. Frequent urination or urgent need to urinate. Don't dismiss changes in your bathroom habits. Last but not least, let's talk about another symptom that might seem unrelated to ovarian cancer: changes in your urinary habits. Now, I know nobody likes to talk about bathroom stuff, but trust me, this is important. It's something we often overlook or feel embarrassed to discuss, but it can be a crucial indicator of our health. Just like with the other symptoms we've discussed, it's all about noticing any unusual or persistent changes. Keeping track of these changes can help you and your doctor understand what's going on. Imagine this: you find yourself needing to urinate more often than usual, even if you haven't been drinking more fluids. This can be confusing and concerning. You might even experience a sudden, urgent need to go, the kind where you barely make it to the bathroom in time. This urgency can be alarming and disruptive to your daily life. This urgency can be especially bothersome at night, disrupting your sleep and leaving you feeling exhausted. Nighttime trips to the bathroom can affect your overall well-being and energy levels. Now, I know what you're thinking. Frequent urination can be a sign of many things, like a urinary tract infection. And you're absolutely right, it can also be related to other conditions like diabetes or bladder issues. But if you're experiencing these changes in your urinary habits and they don't seem to have a clear cause, like an infection, it's crucial to talk to your doctor. Don't ignore these signs or assume they will go away on their own. It could be a sign of something more serious, like ovarian cancer. Early detection is key, and discussing these symptoms with your healthcare provider can lead to timely and potentially life-saving interventions.
And there you have it. 4 ovarian cancer symptoms that every woman needs to know. Remember, these symptoms can be caused by conditions other than ovarian cancer, but if you experience them regularly or if they worsen, it's crucial to see a doctor. Don't hesitate to advocate for your health and ask for the tests you need. Early detection of ovarian cancer can significantly improve treatment outcomes, so staying informed and proactive is key. Thanks for watching ZenZone Health. Don't forget to like, share, and subscribe for more health tips and information.
Welcome to ZenZone Health. Today, we're discussing the 7 warning signs of pancreatic cancer. Pancreatic cancer often goes undetected until it's advanced, making early detection crucial. Knowing what to look out for can make a real difference. We'll cover 7 key symptoms you should be aware of. Experiencing one or a few of these symptoms doesn't automatically mean you have pancreatic cancer. However, if several symptoms persist or worsen, talk to your doctor. Early detection is key to improving outcomes. Let's get started. The first warning sign is jaundice, characterized by yellowing of the skin and eyes. This yellowing can be quite noticeable and is often the first symptom that prompts individuals to seek medical attention. This happens due to a buildup of bilirubin, a yellow pigment from red blood cell breakdown. Bilirubin is normally processed by the liver and excreted from the body. Normally, the liver processes bilirubin efficiently, but a pancreatic tumor can block the bile duct, causing accumulation. This blockage prevents bilirubin from being excreted, leading to its buildup in the body. This blockage leads to jaundice. The skin and eyes turn yellow as bilirubin levels rise. Jaundice can also be a symptom of liver disease or gallstones. These conditions can similarly interfere with the liver's ability to process and excrete bilirubin. When combined with other symptoms like abdominal pain or weight loss, jaundice can be a more serious indicator. It could indicate pancreatic cancer, a serious condition that requires immediate medical attention. If you notice yellowing, contact your healthcare provider promptly. Early consultation can lead to better outcomes. Early detection and intervention are crucial. Screening tests can help identify the underlying cause of jaundice. Don't hesitate to ask questions and seek medical advice. Understanding your condition is important for effective treatment. Noticing jaundice early can be a crucial step in diagnosing underlying issues. Early diagnosis can lead to more effective treatment and better health outcomes. Our second warning sign is unexplained weight loss. Sudden weight loss without changes to diet or exercise is concerning. Pancreatic cancer can disrupt digestion and nutrient absorption. The pancreas produces enzymes crucial for breaking down food. A tumor can interfere with this process, leading to malabsorption and unintended weight loss. This weight loss is significant and rapid. If you experience unexplained weight loss, especially with other symptoms, seek medical attention. Your doctor can evaluate your health and conduct tests. Investigate the cause to rule out serious issues. The third warning sign to be aware of is abdominal or back pain. This type of pain can be a significant indicator of underlying health issues. Pancreatic tumors can press on nearby organs, nerves, and blood vessels, causing persistent pain that can be quite debilitating. This pressure can lead to a variety of discomforts. This pain can be dull, aching, or sharp, and may radiate to the back, making it difficult to pinpoint the exact source. It can interfere with daily activities and reduce quality of life. It's important to distinguish this from occasional stomach aches or muscle strains, which are usually temporary and less severe. Persistent pain is a red flag. The pain is often persistent and doesn't go away easily, even with over-the-counter medications. It can be a constant reminder that something is not right. Pain in the upper abdomen or that radiates to the back can be a sign of pancreatic involvement. This type of pain should not be ignored, as it may indicate a serious condition. If you experience persistent or worsening pain, especially when accompanied by other symptoms like weight loss or jaundice, see a doctor immediately. Early intervention is key. They can evaluate your symptoms and conduct tests to determine the cause of your pain. Diagnostic tools like ultrasounds and CT scans are often used. Don't dismiss persistent pain. It's your body's way of signaling something might be wrong. Ignoring it can lead to more severe health issues down the line. Early diagnosis is crucial for effective treatment. The sooner a problem is identified, the better the chances for a positive outcome. Always listen to your body. The fourth warning sign to be aware of is a loss of appetite. This can manifest in various ways, such as a decreased desire to eat or feeling full very quickly after starting a meal. The tumor can interfere with the production of digestive enzymes, which are crucial for breaking down food and absorbing nutrients, leading to malabsorption. This disruption in digestion makes eating less appealing and often contributes to feelings of fullness or discomfort, even after eating small amounts. Changes in appetite are often subtle and can be easily overlooked, especially if they occur gradually over time. However, a persistent and significant loss of appetite should not be ignored, as it can be a sign of an underlying health issue. If this symptom is accompanied by other signs, such as weight loss or fatigue, it is crucial to consult a physician. A healthcare professional can evaluate your symptoms thoroughly and perform the necessary diagnostic tests to determine the cause. Early diagnosis and treatment are essential for managing the condition effectively and improving the prognosis. The fifth warning sign is dark urine. Jaundice, caused by a buildup of bilirubin, can also affect urine color. Elevated bilirubin levels can make urine appear darker, often brown or tea-colored. This change can be a subtle but important indicator. Pancreatic cancer can obstruct bile ducts, leading to dark urine. If you notice persistent dark urine, especially with other symptoms, contact your doctor. They can assess your condition and conduct tests. Persistent dark urine should be evaluated by a healthcare professional. The sixth warning sign is digestive problems, including nausea, vomiting, and diarrhea. The pancreas produces enzymes that break down food. A tumor can disrupt this process, leading to digestive issues. Pancreatic cancer can obstruct enzyme flow, causing malabsorption. This can manifest as diarrhea, greasy stools, and abdominal discomfort. Nausea and vomiting can also occur due to the tumor's impact. Persistent digestive problems should not be dismissed. Consult a doctor if you experience these symptoms. They can evaluate your symptoms and conduct tests. Early diagnosis is crucial for effective treatment. The seventh warning sign is new-onset diabetes. The pancreas produces insulin, regulating blood sugar levels. A tumor can interfere with insulin production, leading to sudden diabetes. This new-onset diabetes is often accompanied by other symptoms. The combination of these symptoms should prompt immediate medical attention. If you develop diabetes unexpectedly, especially with other symptoms, consult a doctor. They can conduct tests to determine the cause. Early detection of pancreatic cancer is essential for effective treatment. Pancreatic cancer is serious, but early detection can improve outcomes. If you experience any of these 7 warning signs, contact your healthcare provider. These symptoms can be caused by other conditions as well. If several symptoms persist or worsen, seek medical attention promptly. Your doctor can conduct a thorough evaluation. Thank you for watching ZenZone Health. Don't forget to like, subscribe, and share this video. Early detection can save lives.
Anal cancer is not a topic most people want to think about. It can feel uncomfortable to discuss, but it's important. We need to break the stigma. Early detection is key for successful treatment. Ignoring potential symptoms can have serious consequences. Don't be afraid to talk to your doctor. Your health is worth it. We need to create a space where everyone feels comfortable seeking help. This starts with open conversations. Knowledge is power. Let's break down the barriers and talk about anal cancer. Together we can make a difference. Anal cancer often presents with noticeable symptoms that should not be ignored. Pay close attention to your body and any changes you might notice. Unusual bowel movements, such as persistent diarrhea or constipation, are a red flag. This includes blood in your stool or changes in stool consistency, which can indicate internal issues. Pain or discomfort around the anus, especially if it persists, is another warning sign that should prompt a medical consultation. Don't ignore persistent itching or burning sensations, as these can be indicative of underlying problems. Bleeding from the anus, even if it's small or occasional, should never be ignored. It could be a sign of something serious. Discharge from the anus, whether it's clear or bloody, can also be a symptom of anal cancer. Finally, be aware of any unusual lumps or swelling around the anus. These could be indicative of a tumor or other growth. If you experience any of these symptoms, it's crucial to see your doctor immediately. Early detection can make a significant difference. Early detection is crucial for better treatment outcomes. Regular checkups and being vigilant about your health can save your life. Like many cancers, anal cancer develops from a complex interplay of factors.
Genetics plays a significant role in this process. Some people are genetically predisposed to developing certain cancers, including anal cancer. This means that if you have a family history of cancer, you might be at a higher risk. Anal sexual intercourse is another risk factor that can contribute to the development of anal cancer. It's important to be aware of this risk, especially if you are sexually active. This is due to the potential transmission of the human papillomavirus, or HPV, which is a significant concern in sexual health. HPV is a common sexually transmitted infection that affects millions of people worldwide. It's crucial to understand how it spreads and how it can be prevented. Certain strains of HPV are known to cause anal cancer. These high-risk strains can lead to cellular changes that may develop into cancer over time. Other factors can also increase your risk of developing anal cancer. It's not just about genetics and HPV. Lifestyle choices play a part too. These include a weakened immune system, which can make it harder for your body to fight off infections and diseases, including cancer, and a history of smoking. Smoking has been linked to many types of cancer, and anal cancer is no exception. Understanding these causes empowers us to make informed decisions about our health. By knowing the risks, we can take steps to reduce them and protect ourselves from developing anal cancer. While you can't control every risk factor, there are steps you can take to reduce your chances of developing anal cancer. Vaccination against HPV is crucial. This vaccine protects against the strains most commonly associated with anal cancer. Practicing safe sex is also vital. Use condoms consistently and limit your number of sexual partners. This reduces your risk of contracting HPV and other sexually transmitted infections. Regular screening for anal cancer is important, especially for those at higher risk. Talk to your doctor about the appropriate screening schedule for you. Section 5. The importance of early detection. Early detection is the key to successfully treating anal cancer. When detected early, treatment is often less invasive and more effective. Regular checkups and screenings are crucial for early diagnosis. Don't be afraid to discuss any concerns you have with your doctor. They are there to help you. Early detection can make a significant difference in the outcome of the disease. Your health is your priority. Don't delay seeking medical attention if you notice any unusual symptoms. Section 6. Living a healthy lifestyle. Living a healthy lifestyle is not just about looking good, it's about feeling good and reducing the risk of various diseases. While genetics and other factors play a role, adopting a healthy lifestyle can significantly reduce your risk of anal cancer. This includes making conscious choices about what you eat, how you move, and how you manage stress. Maintaining a healthy weight is essential. Excess weight can put you at risk for a variety of health issues, including heart disease, diabetes, and certain types of cancer. Obesity is linked to an increased risk of many cancers, including anal cancer. It's important to understand that even a small amount of weight loss can have significant health benefits. A balanced diet rich in fruits, vegetables, and whole grains is crucial. These foods are packed with vitamins, minerals, and fiber that support overall health. These foods provide essential nutrients and antioxidants that protect against cancer cell growth. Incorporating a variety of colors in your diet ensures you get a range of nutrients. Regular exercise is also important. Physical activity helps to keep your body strong and your mind sharp. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This can include activities like brisk walking, cycling, or even dancing. Physical activity boosts the immune system and helps maintain a healthy weight. It also reduces stress and improves mental health, making it a key component of a healthy lifestyle. Section 7. Don't be afraid to seek help. We understand that discussing anal cancer can be uncomfortable, but it's crucial to remember that your health is your priority. Don't be afraid to seek help if you have concerns. Your doctor is there to provide support and guidance. Open communication is essential. Share any symptoms or concerns you have, no matter how small they may seem. Remember, early detection saves lives. By addressing your concerns promptly, you are taking a proactive step towards protecting your health. Section 8. Your health is your priority. Anal cancer is a serious topic, but it's one we need to discuss openly. By understanding the causes, symptoms, and prevention methods, we can take charge of our health. Remember, early detection is crucial. If you experience any unusual symptoms, don't hesitate to seek medical attention. Your health is your priority. Let's break the stigma surrounding anal cancer and create a space where everyone feels comfortable seeking help. Together, we can make a difference.
Welcome back to ZenZone Health. Today, we're tackling a serious topic, the early signs and symptoms of esophageal cancer. Now, this is a tough one because this type of cancer is often diagnosed late, which is why knowing what to look for is so important. We're going to break it down, make it easy to understand, and empower you to take control of your health. Make sure to subscribe to our channel for more health tips and information.
Have you been losing weight without even trying? Now, while that might sound good at first, it's actually a major red flag when it comes to esophageal cancer. You see, almost half of the people diagnosed with this type of cancer experience significant unexplained weight loss. And the reason? Well, it all comes down to your esophagus, the tube that carries food from your mouth to your stomach. As the tumor grows, it makes it harder to swallow, and let's be honest, who wants to eat when it's painful? This leads to decreased appetite and, you guessed it, weight loss. So if you're noticing the numbers on the scale dropping for no apparent reason, don't brush it off. Talk to your doctor.
Now, let's talk about a symptom that might seem completely unrelated to esophageal cancer: a persistent cough. I'm not talking about the occasional tickle in your throat. I'm talking about a dry, nagging cough that just won't quit, especially after you eat. This is often linked to complications from esophageal cancer. It's like your body's trying to clear something that shouldn't be there. And speaking of clearing things out, you might also notice an increase in saliva production. This is your body's way of trying to help food pass through the narrowed esophagus more easily. So, if you've got a cough that's hanging around longer than usual, especially if it's worse after meals, it's time to get it checked out. Let's be real for a second. We've all experienced heartburn and indigestion at some point, especially after a big meal or one too many spicy tacos. But here's the thing. These common discomforts can also be early warning signs of esophageal cancer. When a tumor starts growing in your esophagus, it can cause irritation and inflammation, leading to that burning sensation in your chest and upper abdomen. Now here's where it gets tricky. These symptoms can easily be mistaken for acid reflux or GERD, which, by the way, is a risk factor for esophageal cancer. So how can you tell the difference? Pay close attention to the frequency, intensity, and duration of your symptoms. If you're experiencing heartburn or chest pain more often than usual, if it's more intense, or if it lingers even after you pop an antacid, don't ignore it.
Chapter 4, Hoarseness when your voice takes an unexpected vacation.
Ever wake up with a raspy voice or find yourself struggling to hit those high notes, even when you don't have a cold or the flu?
Well, that unexpected hoarseness, my friends, could be a sign of something more serious brewing beneath the surface. You see, when a tumor grows in your esophagus, it can sometimes press on a nerve called the recurrent laryngeal nerve.
This nerve plays a crucial role in controlling your vocal cords, and when it's being squeezed or irritated, you might experience changes in your voice.
So if you're noticing hoarseness or a loss of voice that's not related to a respiratory infection, don't just chalk it up to allergies or overuse. Chapter 5, Painful swallowing when eating becomes a chore.
Eating should be enjoyable, right?
But when you have esophageal cancer, something as simple as swallowing can become a painful and difficult ordeal. As the tumor grows, it narrows the passageway in your esophagus, making it harder for food to pass through.
Imagine trying to squeeze a large burrito through a straw. That's kind of what it's like.
This can lead to pain or discomfort when swallowing, a sensation of food getting stuck in your throat, or even a feeling like food is moving slowly down your esophagus.
If you're experiencing any of these symptoms, don't just try to power through it.
Chapter 6, Regurgitation of food, not your average dinner guest.
Picture this. You're enjoying a delicious meal, but a few minutes later the food makes an unwelcome reappearance, and I'm not talking about a little bit of reflux.
I'm talking about full-on regurgitation where food comes back up whole and undigested. Now, this is not something to be embarrassed about, but it is something to take seriously, especially if it happens repeatedly.
When a tumor obstructs the esophagus, it creates a roadblock for your food, making it difficult for it to reach its destination, your stomach.
So, Instead of continuing its journey downward, the food might decide to make a U-turn, leading to regurgitation. This is a particularly distressing symptom that's reported by about 40% of people with esophageal cancer. Chapter 7. Fatigue beyond your average tiredness. We all feel tired from time to time, right? But the fatigue associated with esophageal cancer is different. It's a persistent, unrelenting exhaustion that seeps into your bones and makes even the simplest tasks feel impossible. Now, fatigue on its own can be a symptom of a whole host of conditions, but when it's coupled with other red flags, like unexplained weight loss, difficulty swallowing, or persistent heartburn, it's a sign that something more serious might be going on.
Esophageal cancer often affects individuals between the ages of 45 and 70, a time when many people are juggling careers, families, and other responsibilities. So it's easy to brush off fatigue as a normal part of aging or stress.
Chapter 8. Hiccups and shortness of breath. When breathing becomes a struggle, let's talk about two symptoms that might seem a bit surprising in the context of esophageal cancer: hiccups and shortness of breath. Now, I know, hiccups, really? But trust me on this one. When a tumor grows in your esophagus, it can irritate or compress the diaphragm, the muscle responsible for your breathing. This can lead to those annoying involuntary spasms we all know and love, hiccups.
And as the tumor continues to grow, it can put pressure on your lungs, making it harder to breathe, resulting in shortness of breath. This symptom is more common in the later stages of esophageal cancer, but it's still something to be aware of.
Chapter 9. Back pain and bone tenderness beyond the aches and pains. Now, we're talking about back pain, something that many of us experience at some point in our lives. But when it comes to esophageal cancer, back pain can be a sign that the disease has spread beyond the esophagus. You see, as the tumor grows, it can invade nearby tissues and organs, including the bones. This can lead to persistent back pain, tenderness in the bones, or even fractures. Now, it's important to remember that back pain is incredibly common and can be caused by a wide range of factors, from muscle strains to arthritis. But if you're experiencing back pain that's severe, persistent, or accompanied by other symptoms like unexplained weight loss or difficulty swallowing, it's crucial to get it checked out. Outro: early detection is key. Thanks for sticking with me through this important discussion about esophageal cancer. Remember, early detection is key when it comes to improving outcomes for this disease. If you're experiencing any of the symptoms we've talked about, don't wait, don't hesitate, and don't brush them off as no big deal. Schedule an appointment with your doctor, get the proper evaluation, and get the answers you need. Don't forget to like, share, and subscribe for more health-related content. Stay healthy and stay informed.